Good morning, ladies and gentlemen. First of all, I would like to apologize for the way I am dressed. I am a victim of an airline that lost my luggage. And by the way, Ms. Ganda Wali, UNODC's executive director, is running a little bit late. She is another victim of air traffic. She will come in, but definitely a little bit later. President of the General Assembly, Secretary General, Excellencies, distinguished delegates, ladies and gentlemen, a very warm welcome to the launch of the 2022 report of the Secretary General on the work of the organization. In particular, my address aims to give you a glimpse of today's global drug landscape and the efforts the UN has made to tackle drug abuse and trafficking as well as other related crimes throughout 2022 around the world. As we well know, drugs threaten the well-being of people everywhere. According to new estimates, some 35 million people in the world suffer from drug use disorders and require urgent services. Furthermore, drugs undermine security and development in some regions. As an international community, it's a must for us to come together and share the responsibility for tackling the global drug problem. Growing economic uncertainty and the COVID-19 pandemic have exacerbated global problems related to drugs, organized crime, and terrorism. Consequently, we are seeing an increase in illicit trafficking in firearms, violence against women and girls, trafficking in persons, and a deteriorating situation for people in prison. Societies also continue to grapple with drug problems, including opioids and new psychoactive substances. The responses to this crisis have been hampered by corruption and economic crime. In conflict-ridden and fragile regions, terrorists exploit the political and social-economic fallout of the pandemic. The global threat posed by Daesh, Al-Qaida, and their regional affiliates is compounded by growing concerns over terrorism rooted in racism and intolerance, or terrorist crimes targeting victims on the basis of their religions or beliefs. To this end, in 2022, the UN invested $399 million in key programs to counter world drug problems and the scourge of terrorism, transnational organizations, and corruption, while fostering justice, research, trend analysis, and forensics, as well as providing policy support and technical assistance. Drug use was the culprit of 585,000 deaths in 2021. That's more than half a million, mostly young men and women. More than half of these deaths are attributed to untreated hepatitis C among people who use drugs. Gaps in terms of prevention and treatment, therefore, are an important dimension of the challenges we face. Drug-associated disorders are particularly prevalent in prison settings. Those incarcerated face higher risk of HIV and hepatitis C transmission, yet they are severely underserviced by treatment programs. In 2021, North America saw the number of overdose deaths resulting from the use of opioids rise by some 14%. I am sure I do not have to emphasize to the US audience the grave impact of this phenomenon on the whole society. Meanwhile, in other parts of the world, there is a very different kind of opioid crisis experienced by most of the world population lacking access to legitimate pain relief medication. Therefore, as much as we need to act on the opioid crisis as discussed in the US type context, the removing of barriers which limit the availability and accessibility of controlled drugs for their medical use around the world is another urgent priority. It goes without saying that such increased accessibility needs to be accompanied by actions combating the diversion of prescription drugs for non-medical use. It is true that many countries struggle to create such capacity, but this should not be a reason why more than 80% of the world's population lacks access to legitimate pain medication. Furthermore, there is another kind of opioid crisis affecting Africa, especially in West, Central, and North Africa. A healthcare worker in Africa warned us. Young people trying to cope with poverty resort to opioids. Almost half of all countries have reported non medical use, seizures, or trafficking of tramadol, an opioid painkiller. To this day, this situation remains outside international control. Therefore, there is an urgent requirement for new approaches to containing these problems, like the United Nations 2022 Synthetic Drug Strategy launched to support countries in addressing the situation. The launch of this new strategy comes at a critical moment. The number of new psychoactive substances emerging on illicit drug markets has increased sixfold in the past decade and reached a record high of over 1,000 unique substances in 2020. Annual global seizures of amphetamine type stimulants increased by 64% in 2019, while opioid use disorder deaths have gone up by 71% over the past decade. The new synthetic drug strategy builds on UNODC's experience and lessons learned from the past years in dealing with the opioid crisis. The strategy will offer a balanced and comprehensive framework that is grounded in science, with a particular emphasis on evidence-based responses for women and youth in recognition of the specific challenges they face. As well, the UN has trained over 2,700 caregivers regarding psychoactive substance use and enhanced the capacity of 1,900 policymakers on family-focused treatment. These efforts benefited more than 34,000 people with drug use disorders and their communities. In 2022, we've engaged over 2,200 people from 500 civil society organizations in crime prevention activities related to the United Nations Convention Against Corruption and the United Nations Convention Against Transnational Organized Crime. We've also trained over 4,000 law enforcement professionals on illicit trafficking, financial flows in 3 Asian countries. We've seen that community outreach has proven to be a key part of any United Nations program implementing youth-centered drug prevention activities in low and middle-income countries. I know that through science, informed processes, evidence, and knowledge, our new strategies will help policymakers introduce effective policy directions and strategies to disrupt the manufacture and trafficking of synthetic drugs and to provide access to treatment in different parts of the world. Taking a swift and comprehensive actions against this systematic drug problem can ensure that no one will be left behind. Finally, there is a continuing persistent need to improve data and analysis given the evolving complexity of global challenges linked to drugs. Sustainable and impartial research enables our understanding of the problems we face and helps inform policy decisions so that we can accelerate concrete actions on the ground necessary to protect people around the world from illicit drugs and associated criminality. This is an essential dimension of the balanced, integrated, comprehensive, multidisciplinary, and scientific evidence-based approach to the world drug problem for which the CNDS ministerial declaration has called. I hope the findings presented today and the discussions it generates will contribute to further collaborative thinking and action. Thank you once again for your interest in this very important topic, and allow me, please, to now give the floor to my colleague Chloe Camperters, UNODC's Chief of Research, who will elaborate on the key findings of the World Drug Report 2022. Thank you very much.